All right. Hi, everyone. So as Buna said, I'm Christina, for those of you who don't know me. And the reason he asked me to speak today is because we're talking about these emotions, guilt, and shame. And my background is in mental health. I have my master's in counseling. And then I went on to get trauma certification. So that's really what my background is trauma-informed care. But recently I've started to get into Christian counseling, which is why I've tried to infuse as much of that into the presentation today. So let's get started. So Abuna started last week by talking about the prodigal son. Oh, there it is. Okay. So he started last week by talking about the prodigal son, and basically that the prodigal son has consciously made a choice to change his circumstances and go back to his father. So today, we'll be talking about what Abuna concluded with, which was the long road home. And this is kind of the point in the story where he turns around, he's ready to repent, but the road back can be long. And like Abuna said last week, the devil can play one of his biggest tricks during this time, because it's kind of when we have to deal with the emotional fallout of what he's done. The guilt and the shame are going to start to eat away at him because he's now thinking about what he's done as he's returning home to his father. And so I really want to discuss those emotions today, the guilt and the shame. But before I get into that, I really want to take a step back and just do a mental health overview, just for a couple minutes, to kind of emphasize that point first. So our culture and our society at this point in time, unfortunately, values the body more than the mind. And we think of, if something's wrong with us physically, we'll do something about it. We will pray about it, but we will also do something about it. We'll go to a doctor, we'll take medication, whatever needs to be done. But when something's wrong with our mind, we tend to dismiss it and play it off. And sometimes we even say, oh, pray about it, or fast, or do something spiritual, and, it'll pass. But unfortunately, especially as mental health awareness is increasing and we start to see that maybe the stigmatization is decreasing a little bit, we start to hear a lot that mental health doesn't discriminate. And I feel like this quote has become something that we hear a lot, especially in the wake of celebrities who are either talking about mental health or through celebrity suicides. And of course, mental health has been shown to be linked to our physical health. It's been linked to diabetes, heart disease, and multiple gastrointestinal diseases. It's also been shown to have impacts on cognitive performance and our immune system. And left untreated, the symptoms of mental health, like sadness, anger, loneliness, isolation, they increase our chances of early death by 45%. That's a significant, number. And even more, there's research that's shown that isolation and loneliness, just those two things, are comparable to smoking 15 cigarettes a day. But the biggest problem with mental health is that we tend to treat the symptoms, but not the problem. And what I mean by that is, like I said, we talk about the sadness, the anger, the loneliness, the isolation, the guilt, the shame, but what's underlying that? And while research has shown that faith is a protective factor, and it does help people cope with depression and different stressors in life, including physical illness, but at the same time, we cannot blame our lack of spirituality as a reason for why we might struggle with issues of the mind. In fact, using lack of spirituality as a reason for why we might be struggling tends to deepen people's guilt, and that probably just reinforces how they're already feeling. And Abuna mentioned a good point last week, is that the church is on the decline. And part of that might be because, he said, we don't foster joy. And our position on mental health, I believe, does play a factor into that, because we need to be more accepting and more forgiving of, how people might be struggling. Because as sympathetic as we are to people's physical illnesses, we need to be able to show that same empathy towards their mental illnesses. And just to kind of bring that home, mental health affects 1 in 5 people. So if we look around the room, that there are people in here who could be struggling, because that's how, prominent it is. And unfortunately, there's no quick fix to mental health struggles. Okay, there's not a single solution. With the same token that we want to treat it as physical illness, where if you have diabetes, there's a known solution, with mental health, that's not the case. And there are hundreds and hundreds of kinds of therapy now. And so sometimes there isn't a one-size-fits-all type of treatment, and we need to be more patient as we bring awareness to mental health, because there isn't one solution for everyone. And so the best way to kind of look at this is to take a holistic view on mental health. And what I mean by that is our body and mind and spirit are all interconnected, and they contribute to our wellness. But we also need to take care of each individual part. And just like you wouldn't expect the spirit to be solely responsible for taking care of the body, in the same way we can't depend on the spirit and the body to be responsible for the wellness of the mind. And finally, really just to kind of bring home the importance of mental health, I think the best kind of way to explain that is to explain the placebo effect. And some of you may be familiar with the placebo effect, some of you may not, but what the placebo effect is, it's a method used in clinical studies where basically to be able to see if a treatment is effective, they give another group of people a fake treatment. But they tell them they've given them the real treatment. What they end up giving them is usually sugar pills or something that just has no effect on the body. But what they end up finding is that they report feeling the same improvements as people who actually did get the treatment. And we've seen this in cases of pain management and insomnia and nausea and blood pressure and digestive issues. We've seen people who don't actually get the medication show improvement. And the reason that is because if you believe that the medication you've been given, even if it isn't real medication, can have the power to change you, your mind has the power to give you that change and to influence that change on your body. And that's the power of the mind. So I really wanted to emphasize that point, that sometimes we discount how powerful our mind is, but the mind is kind of where everything starts. So let's get into our topic for today, which is guilt and shame. The first thing I want to do is differentiate between them, because I think that they get used a lot interchangeably, but they are different. And actually, I don't feel, with guilt, I really don't want to classify it as a negative thing, because it is important, because guilt is our feeling or responsibility for remorse of a wrongdoing. And that's important because we need to be able to recognize when we've done something wrong. Without guilt, we won't be able to recognize that we've done something wrong. And the thing about guilt is it also motivates us to change. So if it allows us to, if I feel guilty for something, I'm going to look at how I can make amends. I'm going to look at how I can seek forgiveness or restoration for what I've done. So guilt focuses on the act. What have I done wrong? Shame, on the other hand, focuses on the self. These are the painful feelings that arise from what you've done something wrong. So this is where we start to believe that we're flawed or unworthy. It's not about what you've done, it's about who you've become as a result of what you've done. And it condemns you as a person. So if you've done something wrong, kind of as a way to understand, if you've done something wrong, I can make it right, or I can at least ask for forgiveness. That's the guilt. But if something is wrong with me, then what can I do about it except to find a way to punish myself? Shame is what tells us that our sin has ruined us forever, and we start to experience that feeling of self-loathing. And the power of shame is that if you believe you're worthless, you're not going to treat yourself well. And consequently, you're not going to be able, if we go back to our wellness diagram, you're going to see impacts on your body and on your spirit as well. So, and if you're not treating yourself well, you're not going to be able to treat others well either. So let's talk a little bit about the impact of guilt and shame. And I want to start by taking it from an individual level. How does it affect you individually? Well, the first thing is that it's going to affect your attitude and optimism in life. Guilt leads to a lot of other emotions, sadness, anger, and anxiousness, and those emotions continue to weigh us down. And it's that pervasive feeling of guilt that eventually turns to shame. The second thing is it's going to affect your self-esteem. And this is a lot where shame comes into play. Shame only magnifies and worsens the negative feelings because the shame begins to identify who you are as a person. It's defining you. And our guilt transforms into failure, which then defines our worth as a person. So we are flawed, we are worthless. Those are the things we start to believe about ourselves. And then third, like I said earlier, it'll affect your physical health. These feelings are crippling, and they carry so much weight and bring so much stress and exhaustion into our lives that the pain of not dealing with them is going to have an impact on your life. And the thing about emotional pain is it has to be channeled into something. It can't just be left there. So even if we are not dealing with it, we have to find a way to distract ourselves from it. And in this day and age, there are so many distractions and so many ways to disconnect from how you're feeling. And I use the word addictions, and I feel like when I use that word, people immediately think drugs and alcohol, but there's so many addictions nowadays. We talk about food, television, especially in an era of binge watching and kind of being able to pervasively sit there for hours and hours and disconnect. And then, of course, social media, which allows us to kind of mindlessly scroll and scroll and scroll for who knows how long. And the problem isn't with the behavior. Again, the problem is the overindulgence in that behavior as a way to avoid reality. And the example I use to contrast that is cleanliness. We don't think of cleanliness as something that's bad. I mean, who would say, oh, being too clean is a bad thing? But the overindulgence in that activity can be a problem, especially if it starts to build anxiety and starts to affect your ability to do other things because you need things to be clean. And then, of course, as we start to mellow in these addictions and they become kind of a routine in our life, we reach a place called learned helplessness or despondency. What does that mean? It's kind of when you've reached a point in life where you're just going through the motions. You're living in apathy. You're kind of, I would say, you're in a state of numbness and despair. And Dorothy Sayers, who was a mystery novelist, but then became a Christian theologian. I think she described it best when she wrote that this is the place where you're at the sin that believes nothing, cares to know nothing, seeks to know nothing, loves nothing, hates nothing, finds purpose in nothing, and remains alive because there is nothing for which it will die. So it really is that you've gotten to kind of a point where your unhealthy coping mechanisms have led you to a life that no longer has direction. And that being said, as much as you may be feeling like these emotions are crippling you emotionally, physically you can continue to go about your daily life and continue the responsibilities that you have, whether it's to your job or to your family. So sometimes even though someone may not appear to be struggling, they could be still struggling. And if we talk about our culture and our society right now, new research is also showing that there is an association of being overworked and stressed with prestige and status. That those are things we value now. So the fact that you wouldn't be able to find the direction that your life is supposed to be headed in because you're so distracted by all these things, people see that as a good thing now. And that's something to pause and think about as well. So I want to talk about the manifestation of these emotions, is how they play out when we talk about our relationships with other people. So, and I feel like this one is where shame really comes into play. We find that people start to move towards others. There's some people; these are who you would consider people pleasers, and they are constantly seeking validation from other people because they can't seem to give themselves that validation. And they're the kind of people that need the compliments to keep coming, keep them coming, because I really need that validation to prove to myself what my worth is. And then there's people who move against others. These are the kind of people who you would think you would need to walk around eggshells around them. They become extremely defensive at the slightest invalidation because they already know how shameful they are and how worthless they are. So they don't need you to kind of confirm that to them. So they tend to get really angry and really defensive. And then there's those, and this can also manifest in anger towards yourself, and that's where we see things like self-harming and suicide and those kinds of behaviors. And then finally, there's moving away from others, and these are people who just shut down emotionally and they withdraw, and they really just don't want their weakness exposed. So they tend to isolate themselves and try really hard not to have to interact with people. So let's shift gears and I given you a background, so let's talk about how we can overcome this, okay? So because I said guilt, I feel, is a necessary emotion, I'm not really going to talk as much about how I feel overcoming guilt is important, because we want to talk about guilt as not overcoming guilt, not as denying or ignoring what you've done, but it's about putting yourself in a solution-focused frame of mind. I've done something wrong. How can I rectify it, but also what have I learned about this? Not just from the experience, but what have I learned about myself? Does overcoming guilt mean you're not going to commit the sin again? No. But rather than trying to ignore it, you are trying to learn from it. And you're putting the focus on what have I learned about myself. And of course, the more we learn, the more we grow. Knowledge is power, and that's why we've done things in here like the Enneagram and things like that help us learn about ourselves, because it's in recognizing these patterns of behaviors that we start to understand why we commit the sins that we do. And a big part of overcoming guilt is saying no to perfectionism. This perfectionism is something that is perpetuated right now in our culture and in our society, and that is the expectation. You need to be perfect, and you can't fall short of that. But it only serves to set up unrealistic expectations for yourself, and it encourages this harsh, negative self-talk, which is, I can't do this. I'm not good enough. I'll never be good enough. And again, that all feeds into the shame. So switching gears into overcoming shame, and I really want to go back to the body, mind, spirit diagram, because overcoming shame is a bit more difficult, and it is time-consuming because it's pervasive and it runs deep. It's a lot more inwardly directed at yourself, and there are a lot of things that can make it seem that it disappears for a bit. So you could come to church one day and hear an empowering message and feel really encouraged. And you may be completely certain that, wow, I do feel like I can accept God's love and forgiveness and overcome. And then the moment you walk out the door, you're paralyzed again by that shame. And you're like, wait, what happened? And it's because that feeling, that emotion, it is so crippling. And you have to be able to overcome the shame-based lie. And that's what I'm going to refer to it, the shame-based lies that you have told yourself over and over and over again. And while you do need to overcome them in a spiritual way, and I'm going to leave that part to Abuna next week, you also need to be able to heal your mind from a mental perspective. And while overcoming shame is complex, the key, and there are a lot of different components to it, but the key is forgiveness of yourself. And sometimes we assume that, well, especially as Christians, well, if you accept God's forgiveness, you should be able to just forgive yourself. And the thing about God's forgiveness is it's a gift. It's one we haven't earned, and it's one that we're given anyway. So why would a gift that I haven't earned help me to forgive myself and overcome my shame? And we start to formulate this idea, well, if God isn't going to punish me, might as well punish myself, because someone's got to pay for what I've done. And that's when we start to inflict that mental and emotional harm on ourselves. And I really want to also pause, because I want to also say that I always ask my patients, what are you getting by not forgiving yourself? Because you also have to acknowledge that there is something that you do get out of that. And sometimes it's giving yourself permission not to have to make changes. Well, this is a sin I keep repeatedly falling victim to, so why recognize what's going on, So let me just ignore what I'm feeling. So the moment you can start to recognize that you are gaining something by not forgiving yourself is kind of one of the first steps towards being honest with yourself. So the first thing is that forgiveness is a choice. We have to make a conscious choice not to live in the past, but to focus on the moment that we're in. And a lot of people can think that forgiveness can be passive, and that it'll come with time. And we say things like, oh, time heals all wounds. And while time is a component, it's not the only thing that matters here. You have to play an active role. And what do I mean by an active role? You have to expose and challenge the shame-based lies you've been telling yourself. And this is through multiple ways. The first thing is that you have to recognize your inner monologue. How do you talk to yourself? And this can be unnerving in this day and age, where it's easy to kind of fill the silence that you have with yourself with distractions. Oh, I have a couple of moments, let me just pull out my phone so that I can not have to deal with my inner monologue, especially if you recognize that your inner monologue is constantly belittling you and making you feel worthless. Well, why am I going to want to kind of sit alone with my thoughts? Let me find a way to distract myself. And kind of figuring out, how do you distract yourself? What are you using? Some people don't necessarily use technology. Some people use books, and some people go for a walk and listen to music. I mean, those are all ways that we kind of try to disengage from our inner monologue. We also have to be willing to feel the pain from that shame. And a lot of people try to kind of shut down emotionally. Well, if I can't deal with the negative emotions, and that numbness, like I talked about, it doesn't allow you to feel happiness either. So you're kind of on this broken path where you're not willing to feel the negative emotions, and then with the same token, you're not willing to feel the positive ones either. And part of overcoming shame as well is what I like to introduce people as mindfulness. And this is kind of becoming something that is appealing more to younger clinicians because it kind of speaks a lot to the technological era that we live in right now. And this is mindfulness. What I define as mindfulness is kind of the act of being with yourself, being still, being present, without anything distracting you. And Melissa Podmore, who's an Australian psychologist, and she talks a lot about mindfulness and does a lot of discussions on mindfulness, she introduces it by saying, there's almost a fear and aversion to silence and stillness. We have completely lost the connection and relationship to silence, and this presents a lot of anxiety for us. You know, we've seen research that shows that stillness and being able to be with yourself can provide you with more stability and more contentment in your life because we become much more aware of ourselves. It forces us to focus on the connection between our body, mind, and spirit without any distractions so that we can start to see what's impacting us. She goes on to say, a lot of people feel that busyness gives them a high level of identity and achievement, and surrendering to silence feels like weakness. It needs to be reframed to be about becoming more intimate with your inner world, because for a lot of people, that is an unknown place. We need to find a way to be okay with the silence and the stillness. It's in that stillness that you are able to start recognizing and dealing with the emotional pain that you've been experiencing. And in fact, it's in that stillness that you can become a non-judgmental witness to your pain. And what do I mean by non-judgmental witness? It forces you to kind of start seeing things from an unbiased perspective instead of being the person who's continually perpetuating those negative feelings. So the first thing was forgiveness is a choice. The second thing, you have to show kindness to yourself. And think about it this way. If someone who you love were to come confess a wrongdoing to you, how would you respond? Would you continue to make them feel guilty about it, or would you show them kindness and compassion? And so why do we struggle to show that same kindness and compassion to ourselves? The third thing is we have to stop cycles of rumination. Rumination is the process of thinking about things over and over and over again. If I'm still thinking about an argument I had with my husband last week, that's rumination. If I'm still thinking, what should I have said? Should I have said that differently? Oh, I would have driven my point home if I would have said that. That's rumination. And I really want to differentiate between reflection and rumination, because reflection is important. We need reflection. We need to reflect on the past. But rumination is kind of this cycle of, we keep beating ourselves up over and over and over again. And it can stay with us for days, weeks, months, even years. And the problem with rumination is that you're not learning anything from what happened. The only thing you're doing is beating yourself up. Whereas reflection, you're trying to learn what you took from the experience. Okay? All right. So we have to actively challenge what the shame has made you believe about yourself. So those are the three we've covered so far. The last one is challenging the shame-based lies. And the one that comes up most often is, I'm not worthy. And how do we overcome that feeling of worthlessness? We need to recognize our worth through God's eyes. And I feel the best way to describe this is to try to parallel it with a real-world example. So if I were to, no strings attached, offer you a $100 bill, just take it. Would you take it? I imagine most people would take it. What if I were to crumple it up, or even throw it out in the street and let cars run over it? And it might get dirty, but you'll probably still take it. Well, what if I ripped it up, or even burned it until it was complete ash? Probably wouldn't want it anymore because you don't feel it has any worth. Well, what if I were to tell you that there is an office in the Department of Treasury that is responsible for recognizing mutilated currency? Even if it's completely burned to ash, they can recover what that value was in that pile of ash. And the reason they can do that is because they created money. And you're no different. Who is your creator? God. And so he's the only person who can define your worth. Even if you believe you're worthless, he's the only one who can define your worth. And so the last part, which is really important, is seeing yourself through God's eyes. And that's how you're going to be able to recognize your worth again. And I think, so kind of concluding overcoming shame, it's really twofold. It's forgiving yourself and accepting God's forgiveness. And I think the perfect example of this is in the Bible, is both Peter and Judas. They both failed Jesus and denied him. Judas couldn't forgive himself and went on to commit suicide, while Peter went on to build the church. And he became a great church leader. And no one remembers him as being a failure. He's remembered as being a great church leader. So by forgiving himself, he was able to complete the life that God had intended for him. And you're no different. If you're able to forgive yourself, if you're able to leave your past behind you, you can become the person that God has made you to be. And sometimes I like to tell people that sometimes we need something tangible to demonstrate kind of the emotional pain that we're feeling. We call it the rock in therapy. And what it is that you kind of put a few rocks in your bag or in your purse, and you carry them around for a while. And you can't. The problem is if you're carrying that rocks that are a load on you, you're going to have to acknowledge it. It's going to create a physical, it's going to have a physical effect on you. So, and sometimes if you can make that emotional pain quantifiable in a way that's physical, you can start to say, oh, wait, well, if this physical pain is something that I'm carrying and is affecting me this much, let me maybe check into my emotional pain and see how that might, it can kind of open the door for you to start wanting to acknowledge that emotional pain because it gives you that tangible representation of it. And I as much as I'm up here talking and trying to throw all this information at you and tell you, oh, forgiveness is a choice, I also don't want it to make it seem like it's easy. Oh, just follow these 4 steps and that's what it's going to take. It's complex, it's messy, it's hard, and I don't want you to think that I've simplified it. But it is a process, it takes time. But in therapy, we always tell people to trust the process because it is a process, but if you trust it, it works. I kind of want to conclude with talking about how can we get to a point of healing and what does that look like? The first thing is that it takes a commitment on your part, and that's the part I've really tried to address today. You have to play an active role in working on yourself and trying to forgive yourself. Is it easy? No. Is it worth it? Yes, 100% yes. The second part is you have to be open to God, his ability to intervene in your life, his ability to help you to overcome these feelings and accept his grace. And like I said, in the beginning, I said faith is a protective factor, and part of the reason that is because we all have an end goal here. We want to get to heaven, and think about how difficult it is in therapy to start with someone who maybe doesn't have faith, and how you even begin to start instilling that hope, because, they have no end goal. They're just kind of living and trying to get through life. So, being able to kind of start with that hope kind of gives you an edge. And finally, time, which is probably the hardest one because you didn't get here overnight. So the healing process is going to be just as long. You've carried this weight for so long, and it's going to take some time to get over it. And I always tell my patients, emotional weight is no different than physical weight. If you want to lose weight, it's going to take time. So if you want to lose the emotional weight, it's going to take time. There's no quick fix. And I often hear people say, I don't even know where to start at this point. Like, I've just been dealing with this for so long. And part of that is that we have this black and white thinking, or this dichotomous thinking, where we want to make changes. I want to do it today and I want to do it now. And that's kind of how we live our lives, in our jobs and in other responsibilities in our life. You got to get it done now. It's, I want it yesterday. And the thing about this kind of healing is that small changes beget bigger changes. When you make the small changes, you'll start seeing the bigger changes in your life. And that's all I have. Do you have any questions? Thank you. Does anyone have any questions? Yeah, Sandy, go ahead.
I like what you were saying about rumination versus reflection.
Mm-hmm.
And I feel like I've heard a lot growing up that, like, if something is nagging at you, it's the Holy Spirit telling you to, like, address something, which I don't know if that's true or
Mm-hmm.
not. I know myself, I have this super active mind where, like, I'll pass a building that reminds me of someone, and out of total silence, I'll turn to Peter and I'll be like, so how's that person in Florida doing? He's like, how are you even thinking? I'm like, I saw the building, I'm talking about the person, like, anyway. So my question is, do you think that that is, like, is it supposed to be, maybe God speaking to us, or should we see it more as just like we have personality traits, we have mind
I honestly think it's both. I think that God could be intervening in your life, but I also feel that it could be you recognizing a pattern of what your inner monologue looks like. Kind of how do I slow down? If I have an active mind, how do I slow it down? And it may require certain activities that slow down your mind. Things like, I really don't like throwing yoga out there because I feel it has a bad reputation right now. But things like that, and mindfulness I talked about mindfulness a little bit, but it's such an overarching concept, but it kind of stems into meditation and kind of, again, being okay with the stillness. And I think a lot of people struggle with overactive minds, but it's just because of how fast-paced our lives are now.
So you think it could also be like self-knowledge would help you differentiate?
Oh, absolutely. And I do, again, because I do have things that we do in therapy that slow down people's minds. And there are things that prove that you can slow down your mind. No matter how fast it's going, there are things that work to slow down the mind. Yeah, Sarah, go ahead. Mm-hmm.
I wonder if there is a tool that you could think of, like perhaps like maybe debriefing with somebody or maybe journaling about it, something that you think, okay, if I find myself, going through this pattern of rumination, like is there a step maybe that I should take to sort of more tangibly put it to rest?
Oh, absolutely. I recommend journaling to all my patients because it forces you to recognize patterns of thoughts because they're right there written in front of you. And that's one of the biggest ways we deal with rumination is through journaling. Journaling is a big thing because you can go back and say, oh, wait, okay, I've already done this. So how can I move past it now? Okay, it's been a week. Okay, I've been thinking about the same thing over and over again. Okay, I've given myself some. And sometimes the way we start overcoming rumination is allowing it for a certain amount of time. So, okay, I have a problem with rumination. I'm going to let myself, every time I'm going to ruminate over something, I'm going to give myself 2 days. That's it. And I'm going to put a deadline there, 2 days. And, as you start, again, smaller changes beget bigger changes. So if you're able to say, okay, I'm only going to give myself 2 days from now on, then slowly decrease it to 1 day. Then I'm starting to move to reflection. That's what I meant by, smaller changes. Absolutely.
I may confess something, but I may continue to ruminate about it. So it's like maybe a combination of tools that we want to use.
Absolutely. And I think that's why Abun asked me to speak, because I think sometimes we think, oh, confession is the answer, but there's a personal piece too. You got to do the work yourself. You can't just rely on confession to do the work for you. Go ahead. Absolutely. Absolutely.
So how can you just comment on that, like maybe what we can do as a community, what mistakes we're making, what can we do as a community to help us draw people in and give them a resource so that can help them, get through their issues as part of the church community?
Well, absolutely. I think one of the things that that I've seen research suggest is really important is having a counselor in the church and not necessarily even being associated with the church, but just someone who you can refer people to. But I also feel that guilting people, again, we as a church, we also still say, well, if you're not praying, you're not doing your job. And if you're not fasting, well, shame on you. And if you're not having communion, shame on you. And if we can just be welcoming of people when they come, no matter how often they come, no matter how often we see them, no matter what their life looks like. One of the actually, when we think about how the church judges certain people and whatever their lifestyle choices may be. The fact of showing openness is so important, because a lot of those people have lost so much hope, and if you instill that hope in people, no matter what the church might tell you about their lifestyle, that I think that is where I've seen the most impact that the church can have, that we accept you no matter what you come through the door with. Clean slate, whatever it is. There's no but this, but that, but that. Whatever it is, please come through our door, and we will accept you, and we will show you openness, we will show you forgiveness, we will show you compassion, we will show you kindness. We are a welcoming community, and we want you with us. It's not that we tolerate you. We want you.
When it comes to physical health, I know that I have my PCP, and I know that if I have a cold, I go to that person, and I know how to find a PCP. I know how often I should be going, like a 6-month checkup, blood work every so often, whatever. I feel like we don't have the same, not accessibility, but it's not as quick of a grasp in mental health.
Absolutely.
Especially, at least from what I found, there's a bunch of different letters after people's names, and I don't know what any of them mean, right? All I know is that there's something called therapy, there's counseling, there's psychology, could you give a bit of a...
Sure. So the thing about therapy, specifically mental health therapy, is there are different degrees that can lead you to become a therapist. So if you go a social work route, for example, there's a lot of social workers, and I don't know if you want me to get into the specific after name abbreviations, but...
I need to have someone to... Where do I start?
Okay. You know what? You know what I tell people now, and I may be a bit biased, but I always tell people to start online, because that's what I've moved into, is online counseling, because you all know I have a son who I have to stay home with. But the reason is that, one, you're not dealing with someone face-to-face if you don't have to. You can start by kind of seeing what it means to kind of get in touch with your emotions. And sometimes the thing I hear most in therapy is that, wow, where do you come up with these questions? Because, we're trained to kind of draw out certain things in ways that are non-judgmental and allow you to feel more open. And so the place I would start is online counseling. That I think that's the best place to start, because especially the thing about online counseling is that it helps you deal with non-severe forms of mental health issues, relational issues, conflicts, those kinds of things. And I think in that respect, you're able to kind of get a taste or a flavor for what it looks like without having to immerse yourself and commit to a therapist and commit to going somewhere every week and stuff. You kind of get to dabble in it a bit and kind of get a feel for what it's like.
Something that I'm always perpetually going to once a month, once a week, once a year for a checkup, or is it something that I'm getting involved with whenever, maybe for example, I'm going through a hard period?
And again,
for a certain amount of time for that therapy, or is it an ongoing relationship with someone where I'm constantly checking in with myself?
I think it can be different for different people. Some people need people to hold them accountable. If you're not able to do the work on your own and you feel you need someone to hold you accountable, then yes, I would say therapy continuously is important. But if you feel like, and I've seen both. Some people like to check in once a month. Some people like to be ongoing constantly. And some people are like, okay, next year I will check in and I'll see how I'm doing. And some people just need the jump start and then they leave and they go on to do it on their own. I think everyone's different, and only you know your style best, Yep. Anyone else?
I just kind of want to, coming back at what Mark was saying, is as a community, how do we make the community so beneficial for people who are really coming in? And I agree with what you're saying. I think another layer to that is also just in taking down kind of our own personal veneers.
Absolutely.
I come to church and I have to have it all together, and the truth is we know nobody has it together. That everybody is faltering in one way or another, whether it be mental health, spiritual health, you name it. We have all the problems in this room. And the more we are able to create a safe environment for all of us to be transparent with each other, I think it adds a bit of authenticity to any community that says we go well.
Absolutely.
Because it comes from a place of well, I am welcome, repentance, but also the personal transparency, based on the knowledge that that I'm being accepted, and that my worth isn't dependent on anybody here, but my worth is ultimately dependent on God, which is the same case for everybody. So, just that.
Anyone else? Okay. Oh, Sarah, go ahead. Yes.
And so I think that's also a role that the church plays in helping us to, correct our theology around all of that. And as you mentioned earlier, if you cannot give what you don't possess,
Mm-hmm.
you've not accepted, you've not worked through your guilt and shame, you also cannot
Absolutely.
forward.
Mm-hmm.
But that's also a piece in the church helping to
Mm-hmm.
correct, like what is, what does God have to say about that versus what does maybe, my personal upbringing or my culture have to say about
Absolutely.
that, or what does my society have to say about that, and how has that possibly permeated my theology?
Absolutely. And I think that's a big piece as well, is that think about your culture as well, where you come from and how they view mental health. And it's impossible to avoid that was brought into your upbringing. So, we got to check our bias, recognize our bias, and see what we also bring. That was a great point to you, Nabuna. Anyone else? All right. Thank you.
I mean, that was fantastic. Thank you
you.
so much, Christina, for helping out and kind of adding that piece to it. And we're going to kind of finish off our series next week. We're talking about confession, kind of the nuts and bolts of confession, and kind of similar questions that like you were getting of like, well, how often does somebody need to come like for mental health? And like there's certain things that we should address with respect to confession, and that's all kind of related and linked into how we understand confession and the purpose of it, and how actual the confession works out. So we want to kind of work through that, dispel like some confusion that people may have with respect to confession, and why do I need it, and how often should I come, and all these different things. So we want to kind of do the nuts and bolts. And so we've built up to it with repentance, we've built up to it talking about the mental health, and it's really kind of when we do a lot of the homework before coming to confession that we actually get the fruits of confession. Okay, so there's a lot of like pre-homework, self-awareness and mindfulness and prayer and kind of reflecting that leads us up to a more fruitful relationship in confession. So that's what we're going to talk about next week, and hopefully all that prepares us for Lent, which is a great time for us. The church really challenges us to think about repentance and confession and take the opportunity. And so instead of doing it in the middle of Lent and everybody like kind of waits up, wait, like Holy Week, let me do it then. Like, no, let's all do it over the course of Holy Week, or over the course of Lent, not just Holy Week. So other than that, let's stand up and we'll pray.